Welcome to the Rounds to Residency podcast brought to you by MedEd University. Gain residency insights and tips to prepare for your externships, research, and professional development in healthcare. We interview preceptors and physician educators who will prepare you for your rotations and improve your clinical experience. Now here's your host, Chase DeMarco.
Today I am joined once again by Dr. Deason for round 2 of this 10 rounds to residency. This is the glass jaw in your statement, the personal statements that could KO you in your first round. And with all of your experience, Dr. Deason, let's just go off with a general overview. What has been your experience with the personal statement? What are issues that students come across? And then we'll kind of go over my terrible example.
Sounds like a plan, Chase. Yeah, so caveat, my experience does not come from personally serving on an admissions committee, but while I was at Kaplan, I built out their admissions consulting program, during which I consulted with 6 different admissions committee experts who had 20 to 30 years experience each, and I made them give me advice on all the different aspects. And then I took the 6 people's advice and kind of congealed it into one document. And then I sent it back to all of them and said, what do you guys think? What reflects what you believe versus, came from somebody else and you disagree? And I essentially finessed what the best advice out of their 100+ years experience was, and built that out for students to use through what I called the KMAP, Kaplan Medical Admissions Planner, while I was there. But I use a lot of those same philosophies to drive what I do with students now, as well as a couple new philosophies of my own that will apply to your personal statement today. But
so you synthesized hundreds of years of experience into this one document.
Yep.
Is that mostly for medical school admissions, for residency admissions? Is it the same?
The one that I made then was for medical school admissions. Certainly residency admissions has some caveats to it, but I consider it still an extrapolation of what you're doing in your medical school application, which in both instances, what I've encouraged students to do, we all hate bragging about ourselves, right? Like, this is how amazing of a person I am compared to the other people, so you should let me in. Always comes off awkward. So instead, we focus on crafting the future you. Tell me not about who you are right now, but the person you're trying to become. And then in that discussion, tell me about the relevant experiences and translatable skills you've been acquiring through all of your various work and activities to get there.
So as a medical student or a pre-med going into medical school, when someone says, tell me what your future is, the future you,
right?
My first thought is going to what specialty? And that's not really what we're looking for.
Yeah, I actually tell my students, I don't want to know the specialty. That's not what I'm asking for here. The way that I want you to frame it, it can have a specific title or aspect to it, but more, what is the impact you have on those around you? Either your colleagues, the medical education community, the health of your community that you live in. What are you passionate about? And what is that ultimate impact you want to bring? Is it transforming medical education, or is it being the one that can help those in your vicinity or of your ethnicity to better understand their health and better take care of themselves? We can all have our own story. The number one thing is not trying to make yourself fit somebody else's. Own your own story here.
I definitely brought up medical education as something that I put in my personal statement for medical school, and I feel like a lot of people probably do, so that's not going to make me stand out. What is it that you think these admissions directors and others that are going to have a say in the admissions process are looking for that distinguishes the student from everyone else that's saying a lot of the same stuff?
Right. That's a good question. And I would say so much of what we've been trained in mindset-wise is it's the level of our accolade, the level of prestige that matters most in demonstrating to them that we are meant to be there. And it's not per se. The personal statements that list off accolades and things that have already been done and read like a resume, those aren't the ones that are meaningful and impactful. A lot of what they want to see in this admissions process is that out of everything that is out there, you have looked around and passionately committed to this field for a reason. It doesn't have to be somebody else's reason. It can entirely your own. And the best personal statements are story driven, not accolade driven. And you can talk so much more impactfully about the time that someone was in pain and confused and scared, and you reached out and held their hand versus the time that you got to do a really cool medical procedure and you got to intubate on the rotation when other people didn't. Okay, we're going to teach you how to intubate in residency anyways. You don't need to know it beforehand.
Right. And a lot of this we kind of covered in the last episode with your volunteer experiences, with any work-related experiences like paramedic, EMT stuff. Those are definitely helpful,
Yeah.
but they can go back and listen to the last episode for all the details. But they want to show that dedication, that long-term, you've been volunteering for years, or you've had X amount of work experience. So I could see how those particular parts would be beneficial and possibly separating you a little bit. Although most medical students are advised anyway to, when they're pre-meds, to do so much research, so much volunteer experience, that a lot of times that's going to get lost in the shuffle too when they're going through how many thousands of applications. It seems overbearing, I can imagine, from the admissions board, but standing out just seems so difficult.
So yeah, let's talk a little bit about that. Standing out isn't actually always good. It is possible to stand out in a bad way too, right? Which is why there are some personal statement faux pas. And essentially, one admissions advisor I had spoken with said 80% of them kind of blended together. 10% stood out well, and 10% stood out like weird. Like not even like bad writing, but just like weird, or just left a bad taste in their mouth as a reader afterwards about this person.
Ooh, I
So,
want to know those.
right? I would love to have read those examples, but
Yeah.
let's talk about some of those things to avoid doing. Any that you could think of offhand that would be like a big red flag.
Maybe doing some sort of medical procedure or action that you're not licensed or supposed to be doing.
Right?
The thing that comes to mind is, what was it? Dr. Love something. He was like the high school kid in Florida that pretended to be a doctor, faked having a license, went in, was delivering kids and stuff, like all kinds of.
Yeah. So look at all this firsthand experience I've gotten illegally. So that would be a con. Big red flag there. Certain aspects of our life story and how we present them. I am all for owning our foibles and shortcomings as well as our strengths. And a lot of times, if you have a story of something not going according to plan and how you picked yourself up afterwards and you're still here in spite of that, that could be inspiring. And a lot of times it's something that students don't think of as a good thing or a thing that they would want to hide. But at the same time, there's only so much of our negative qualities that we want to focus on and how much of our time we want to dedicate to that. It has to be part of a larger story and redemption arc if you're including it, not just I'm a person who's got a lot of problems.
Yeah, I don't want to say that, I've been addicted to crack cocaine and I stopped last month. I'm doing real good so far. There's not enough of that arc. But a lot of people have suffered from different types of addictions, and showing that arc, like you said, that can be a redemption from it, showing that in the past, hopefully for the most part, you can twist most things around. But at some point, like you said, it you kind of can't get over that hump and might just want to leave it out.
Yeah, exactly. Especially if there's not documented things, you know. If you weren't caught using substances, I wouldn't go into how you
Yeah.
use substances.
Right. Yeah, that's a good point, is the legal history.
Hmm.
Any potential infractions is likely to show up there. And let's face it, you're going through pre-med, you're still in early college. There are parties around, there are things that happen.
Right. We're
Some get caught
subject
more.
to bad decisions or sometimes just being in the wrong place at the wrong time.
I hear ASU is pretty renowned for their parties.
Arizona State University, my alma mater. Yeah, interesting times.
That you did not put on your application or
No,
CV.
not those. We left some of those stories out.
Right.
Yeah.
Okay, so then the other thing we discussed before hopping on here, and it's obviously going to play a huge factor going forward, is everyone's saying, AI, generate this for me. And back just 2-3 years ago, you could go on, find some templates,
Right.
pick bits and pieces, try to see if you could find a transcript or podcast where someone in the know was talking about it.
Yeah.
Now, how do we approach all these different resources? Which ones to use? How to use them? You
Yeah.
know, what's your process?
Absolutely. So I use AI to assist students with personal statement writing, but the caveat here is never anything generative from the AI. Do not use writing by the AI. It is not authentic to your writing. It is not authentic to your speaking. You're going to have to submit secondaries and you're going to have to go and speak with these people in person. And if the story doesn't match the whole way through, that is a big red flag. Now, how do we up level our own writing? You know, the personal statement is something we're giving a lot of time and attention to, and it should be better than our average piece of something we've scribbled out. But as somebody who's written a lot and used AI to put out things that are of, lower hanging fruit for myself, some posts, things like that, there's a pattern to AI writing that is noticeable. And you might not have used AI a lot yet in terms of generative writing, and you think something looks and sounds good, and it can have some obvious red flags and patterns to us folks who use it regularly. So I would say do yourself a favor, stay in the ethical lane. We're going into a field where ethics matters. Be ethical in your approach. However, like I said, one way I use it already is that brain work to framework. The other I do is what I call personal statement score reports. So you can use AI to essentially audit and review the quality of your work. Now, let's talk about how this works. My AI does that based on what I have trained it on. If you're just using off-the-shelf ChatGPT, it's scraping the web and just gathering what the web says is the verdict of good versus bad personal statements. So while it can be helpful and give some points in the right direction, being dependent on something that is scraping random writing doesn't mean you're actually driving towards the best personal statement. What AI thinks is the best personal statement isn't the best personal statement for you.
Yeah, and having used a lot of AI tools over the past, 2 years or so, I know initially when ChatGPT 3.5 came out, it was pretty good. They were just starting to bring out where you could train your own avatar. You
Mhm.
could submit your own writing and ask it to write in, your fashion. And I could never really get it at the time to sound like me. It still had those red flags you mentioned. Now it's getting better every day. Don't know how long that's going to
Right.
be, or the red flags might change. And I
And for me
switched almost.
personally, I've had to train my bot on a few hundred pages of my writing and like 700 PowerPoint slides of my work to get it to replicate me. If you're
Right.
putting in that much effort writing and making content already, you might as well write your own damn personal statement.
That's a good point. Yeah, I've switched completely to Claude for the most part. And so what I had done with some success after that is go to some different websites with credible sources.
Yeah.
Just take what they say the main points are. In paragraph 1, you should cover this. Paragraph 2, you should cover this, et cetera, and feed the guideline into AI and then say, these are the things I want to copy. Here's the guideline. Give me a rough draft. I mean, it's a good starting point. You still want to go through and rewrite it in your own words, like you said, but I feel like that can get people pretty far.
Mm-hmm. So yeah, I'll share screen here for a minute and show you a little bit behind the scenes. So my bot is named after myself because why not? When you go into the edit GPT here, this is where you can see different files that you train your bot on, different instructions that help to prioritize patient safety and confidentiality. There's a lot of important things here. Avoid referencing or creating any hypothetical research papers. That's one I added in after some experiences there. But anyways, as you can see here, there's a limit to the number of documents you can upload, but not like how long those documents are. So while you only see 8 here, each of these is like huge and has like a couple hundred pages of my writings, all of my case decks that I've made in PDF format. But that is what guides my bot to be able to guide students well. And
for those listening to this on podcast, you can check out the video. Will be a link in the show notes, and we might just scrape Brandon's resources here so you can copy and paste them.
So yeah, we'll see about that one. But one of the things I have in there is like a 30-page guide that I wrote for how I want it to assess personal statements.
Nice.
So
okay.
Let me see. Trying to find one of my ones where I was helping with personal statement evaluations.
And while you're skimming through these, especially for the audio listeners that can't see what's going on, we're looking through some different past works that have been uploaded into his personal GPT. I did try to create a couple of them as well back when they first added the avatars in ChatGPT. Named it Med3PO. But these days, I mostly use Claude for personal kind of the ChatGPT like conversations, use Notebook LM now that I finally figured some use cases for it because of the amount of documents you can upload it to it. It's really good for like research and referencing all of your different documents. I find better than some of the others for that. And then Perplexity is nice for research, although when I need just the peer-reviewed or need to differentiate where it's getting its sources, Perplexity's resources for just research purposes aren't always as good as some of the others, like Paper Guide and Consensus.app.
I'll create a new prompt off the cuff here for yours. No worries. I remember mostly what I write. So you were going for what kind of residency here with this personal statement? EM or?
I think that was OEM.
OEM. Copy that. OEM residency. All right. So
yeah, my old ones are in a folder somewhere.
Assess the following personal statement written by a student working with Dr. Deason that is applying for OEM residency. Score the writing in accordance to the personal statement score report guidelines. Document in your knowledge, specifically section 3. Has some things I had to realize. Otherwise, it doesn't always stick to the same categories that it's supposed to. So redirecting it to the appropriate part of your knowledge documentation can help with continuing to get it to do it correctly.
Gotcha.
All right. And we'll just say like, here is the personal statement.
And some of my experiments, it seemed like if I named the document, like copied and pasted the name exactly how it's hyphenated or the uppercase, lowercase, it tends to detect it better as opposed to just a general reference. But that's just anecdotal.
All right, Chase.
Ooh, those are not good.
My bot isn't nice per se. It's real, bro. So your writing has some room for improvement.
Yeah, I see that.
Yeah. So I have 7 categories with the personal statement score report. It is very important that you start strong. And what we recommend is with a story. You got to put us where you were at the time. And a lot of times the best way to start these off is where the seed was first planted in your interest in medicine. Doesn't have to be that, but as a narrative arc, it usually makes for a strong story to say, here's where my interest began, here's the things that really grew it over time, and here's where I'm wanting to go, and finishing with that future self versus just, where I am right now. So your personal statement introduction here was a little more straightforward. I'm writing to express my strong interest in your OEM residency at UPenn. After thoroughly considering my career objectives and aspirations, I am seeking to transition into a program that aligns more closely with my clinical interests and professional goals, particularly in occupational and environmental impacts on health. This doesn't really tell me anything about you. It doesn't put me anywhere. It's not showcasing anything to me. So that's why I think we're seeing a lower score here.
Mm-hmm.
But of course, feedback's always done nice here. We have some strengths for you, Chase. You stated your interest in OEM and that you wanted to make a clear transition. That's good. However, your opening was a little formulaic and lacked emotional engagement or a distinctive hook. It misses an opportunity to connect immediately with the reader through a compelling narrative or reflection. So that's the first thing I would work with you on. And so while I provide the feedback of the personal statement score reports, I also then work with students to interpret that, because a lot of times students are like, yeah, I'm not a good writer. Just telling me my writing is weak and that it needs improvement.
I knew that already.
Doesn't feel like a huge help, Dr. D. Yeah, I kind of had figured that part out on my own, that I suck at writing. That's why I came to you. So yeah, that's why we meet. And so that's what we do first off with the intro. The second score is narrative coherence. So you're trying to use a few stories to demonstrate your path, but there has to be a flow through it. You're not just jumping from experience to experience, one thing or the next. So you gave us your intro and then your body paragraphs here. During my time at
leave
Trinity
names
Health,
out.
Yeah. Gained invaluable knowledge and experience in rural medicine and the independence this setting allows. I'm eager to build on this foundation. However, there are other areas I'd like to develop, be better suited to your program environment. So you're giving me a logical reasoning through this. I'm understanding the why you want to do this, but I'm not understanding anything about you as a person. And when we talk about setting ourselves apart through our applications, we're wanting that reader to walk away feeling invested in us in some way. And that's why I really focus on my personal statements that I work with students on as being aspirational and focused on this person you're trying to become, because that makes your reader engaged and wanting to help get you to that next step. That's what we kind of want to do with that story.
That emotional appeal. Yeah, that's much more important than anything. Determining your knowledge and all that's kind of less important at these stages of your career. But if someone's like, this person sounds cool, I want to help them.
Exactly, man. That's what it's really about. We think that knowledge is the key, but that's just the box we're checking off. Like, we're all graduating medical school. We're all finishing and passing step 1 and step 2. They're not afraid that we won't be able to come in and do the job. They want to know how engaged we're going to be in doing that job. That's what's more important. What kind of person are you going to be like to be around for more hours a week than their family for the next 3 to 5 years? And so when you
Right.
put it in that context, you gotta be personable. You gotta be somebody I want to hang around with. And that all starts in the story that you're showcasing with the personal statement. It's not what you've done. It's not, these are the skills I want to get. It's your opportunity to show who you are as a person. And that's why I start with those qualities. If you don't know where to begin with this, what are the characteristics and qualities you want to showcase? And what are the experiences that you think best showcase those qualities? And that's where we'll then draft a narrative that fits. So maybe this is a multi-step recording for us, Chase, where we've seen your first one here. So let's keep going through the scores real quick. Conclusion, it's got to end just as strong as it starts. Yours, it says, is perfunctory. It doesn't tie back to a unifying theme or leave a lasting impression. That's what we want. We want a powerful reaffirmation of purpose or your future vision in OEM. Again, that's my favorite. Give me your future vision, because you can talk all day about how amazing future Dr. DeMarco is without sounding like a total a-hole. Versus talking about how amazing current Dr. DeMarco is. So
Yep. And you'll
use
find
that.
some people are really good at that when they're talking to a program director, but then when they actually get into the program, they do a lot more of the more negative one, talking about themselves all the time. It's
Yep.
very annoying.
Yep. And so the last areas where we're scoring you here, the emotional engagement, no surprise here, man. This is where it
That's the
really
worst
fell
one.
flat. There was
Yep.
no story, there was no hook, there was no feeling what you were feeling in that moment. So professional development, you were talking about the work, but examples are what drive your story. So this is where we again want to go back to the experiences that showcase what you want to say about yourself. So instead of just trying to be like, I want to do this, this is what I'm interested in, what are the stories that show when you were, driven to want this pivot in your career? Like you're telling me you want to make this change. Why? Not just the skills difference, but why? There's a story behind that. I know there is, Chase. You were, without being too, here's where we got to be careful. We can't shit on the people that we were around, right? Like, these people sucked and made me realize that's not what I wanted to do. We got to be careful. But
Yeah.
we can be like, I started down this path that I thought I was meant to be on. And in this moment, my exposure to this scenario is what made me realize how undervalued OEM was, how much more impact I could have if I could become this OEM physician that affected these kinds of changes.
Right.
Okay? You
And
feel me?
yeah. And it's probably important to mention to listeners, like if you're applying to residency, you're going to have very different things to talk about, different focuses, but it's also not uncommon at all to transfer into a different program. I think the last numbers I saw is something like 25-ish% of physicians do transfer into a different program, whether it's the same specialty or a different specialty. So curating to that point with your past experience, why you're not there, is very important. And yeah, this one didn't cover very much.
Yeah, that's okay. That's what we're going to do here with our iterations, is we'll show them how to get from what you started with to something that really showcases who you are. And so, yeah, lastly, residents with admissions committee, this is something that I do tailor to the type of admissions you're trying to get into. trying to get into med school versus you're trying to get into OEM. I'm already taking that into account. The weakness here, we lacked clarity on why OEM beyond a general interest. So you got to give me that connection between those past experiences and your future goal. Like I was saying, I know there's a story in there. You were doing one thing and realized you wanted to do the other. There was something that triggered that change in your mind. So that's what you'll want to reflect on and find those stories. It doesn't have to be the exact perfect moment as you remember it. Ballpark it, bro. Like, this is where you can be like, you're not lying, but we're not all like, video recorders of things that happened. This is another good reason to document as you go. I sucked at this, but if you can learn to journal major experiences that are happening to you through your pre-med and med student years, it is way easier to talk about them later than when you're reflecting at the time of writing your application over the past 4 years or more.
Fair.
All right. And lastly, I like to give an overall readiness score. So this is where we want to show your maturity in that you're ready to proceed down this path. That's what you also have to demonstrate to admissions committees, right? So this isn't like an overall score. This is your overall readiness, a separate category altogether. So technically I do give 8 scores because there's a total average there at the end. But now the takeaways, what I do with personal statement score reports, it's not just here to shit on you. They're all done in packages of multiple rounds. And I guarantee I will get your score up or your money back. So when we come back for your next iteration, Chase, what we'll do is we'll find narrative to anchor your story in. We'll pick some specific reflective moments from EM that triggered that pivot. And then we'll focus, like I said, whenever you're talking about the future you're trying to become, there's 2 things I want you to think about. If you have relevant experiences, great. But we don't always get those, right? Especially when we're doing a career pivot. So in those cases, if you don't have relevant experience, look for transferable skills. And you can take these from anywhere. I led a 100-person clan in a video game for 4 years and had to deal with all of these dickhead personalities. That's not one I really put on my resume, but I swear to God, I did learn a lot from that.
So then in a future episode, what we can do, first I'll cover why this particular personal statement was done so expediently, which we didn't get into.
Maybe this is still the same episode. We just do a commercial break here or something. Like we could stop the recording, do some of those steps that I was talking about, and then get brainwork to framework made for you, and then get we could come back after you have like a next rough draft, and we'll then run that through the score report again.
All right. Well, the listeners, we will break this into another part. So far, we've covered the first step of the personal statement, kind of the main focus points of it.
We've established that Chase sucks at writing.
Yep, we've definitely established that. Using AI tools, you can kind of use out of the box, but you're not going to get the detail. And then now we're really covering your 7 rubric guide, and we'll see how it
you're more than welcome. Sorry, if you're a listener at home and you want to do something similar to what I've done with an off-the-box AI, it's about more on the front end with the prompt. If you explain to it the 7 scoring categories you want, you can take that right off my website, ddqxlearning.org/ med school admissions or residency admissions. And you'll see right there the 7 categories I use. If you tell the AI to score it on those, it'll at least give you something more focused. But again, you don't know what it's pulling against to grade you and give you those scores. I don't want to give away the full behind the scenes of my document I showed you I have my AI, it's trained on my documentation. My document on doing the personal statement score reports is over 30 pages of my own writing of what constitutes a strong score in each versus medium versus weak in each of those 7 things with examples. That's what it's all based on. And again, my experience is based on my time working with 6 different people who had 20 to 30 years experience and bringing all their advice together. That's what I've based it on, but it's still whatever AI system you're using, it's based on somebody's opinion. Whether it's an LLM and it's scraping random people's opinions off the web, experts or not, mine is based on one expert's opinion from somebody who spoke with at least, several other experts with lots of experience. But still, that's all you're really getting. If you try and buy somebody else's custom AI, a lot of it is like a chat GPT or something just wrapped in a fresh coat of paint and with somebody's extra bit of guidance in terms of what the output should look like when you ask it things.
But it's also pulling from so many different sources that its range of accuracy is going to be much wider, and the precision might not be as close as your very detailed documentation, this closed system that you've tested out on multiple students so far. There's a good chance that it's going to be more accurate and more precise.
The takeaway too for me is you're not trying to write towards what ChatGPT or even my model thinks is a 100 out of 100. My writing is like a 98 out of 100 according to my ChatGPT. Surprise, surprise. It's based on my writing, right? But we're not trying to get you to write like me or what the AI thinks is the best writing. We're looking at it, though, in terms of the score gains. This gave us an idea. You're at a 46 overall right now. Let's see what happens after the next iteration. Are you in the 50s, the 60s? And that's how I've worked with my students. It's about the trend. We've moved in the right direction. We're getting feedback here that says, yes, this is more emotionally engaging. This is a stronger hook. And we don't have to worry about the exact quantitative, like, is this exactly correct that this would be an 82 out of 100? It's that you improved and that there's still room for improvement. But I don't personally even try and drive my students up into the 90s. When I've gotten them into the 80s, I've found it reflects their writing and their story and is a compelling narrative. Pushing beyond that is just push them more towards my writing. And let's be real, I could sit down and write a better personal statement than you or any of these other students based on all the experience I've had, but that's not the job. Just like the AI, we don't want AI to write one that seemingly might be better than yours. It's your story. You've got to get there in terms of how you tell it, but with the right support and the right tools, you can make it a whole lot easier on yourself. And that's what I'll end with today.
So we're going to kind of screw up the 10 rounds. We're going to have to do a rematch on round 2, but join us for episode part 2 of this 10 rounds. On the next episode, we'll cover some improvements on mine. We'll cover some more of the best practices that you've seen in other students, the improvements, and go from there. Thank you, everyone. And do check the show notes for links to the video, to other content. We'll add that in for you.
Right. Thank you, Chase.
The Rounds 2 Residency podcast is powered by MedEd University. Join us at meded.university and tune in next week for more research and rotations resources to help you on your residency journey.